a place as coming to the knowledge of the truth. When you get to that place, he says, you are liberated by what you have learned. In other words, you encounter what has been revealed to you. You now encounter the knowledge that has been given to you.
Credit to you if you stay at home. If you must shop online, use your NCBA credit card. Stay home. Stay safe.
Akili, 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 akili. Let's chase the germs away. Let's chase the germs away by keeping our hands clean. And when you want to sneeze or when you want to cough, do it in your elbow. Let's practice sneezing into your elbow. Are you ready? 1, 2, 3. Achoo! Again. Achoo! Yay! You did it! Germs, germs, germs. They make us sick. Germs, germs, germs are not our friends. Germs, germs, germs. They make us sick. Germs, germs, germs. Germs, germs, germs are not your friends.
With DSTV Now, you open up a world of possibility where your entertainment is ready for you anytime and anywhere. To get connected, ask your parents to go to the App Store, hit download and log in.
Incredible! Incredible!
And while they're there, with DSTV's parental control feature, setting you up for the most fun and safest viewing around is as easy as 1, 2, 3. Amazing entertainment and learning, anywhere with DSTV.
Mama, how can we stop coronavirus?
We can fight its spread by washing hands with soap, like a geisha bar. Stay strong and go so far. Be strong and last long.
Like geisha.
Wali to the row.
He's considered one of the most lethal lyricists of his generation.
Milioni from 10 bob.
An eclectic performer with a number of positive messages, Giuliani joins us this Friday.
Nilibend knees, nika touch heaven.
Imagine, even ndo muingianga kwa klabu.
Having broken the internet with his smash hit Wajinga Nyinyi,
Wakini snipe tonight, si mnajua ni kwa nini.
people have been asking for him, and finally he breaks his silence in this exclusive. I'm talking about King Kaka.
Goodbye, my friend.
My friend, fly, my friend. Goodbye, my friend.
An actor, director, singer, songwriter, the multi-talented Tokodi will get a hot seat on the trend. All this and more only on the trend right here on NTV.
COVID-19 is preventable. Protect yourself, your family, and the community. This message has been brought to you by the Government of Kenya and its partners.
This is NTV.
Hello, East Africa. Good morning and welcome to your world. We asked you what issues you would want us to focus on or to revisit. Well, we've gathered your comments and questions and lined up a panel of experts to focus on those issues. My name is Joseph Warungu and we welcome your views and questions on our WhatsApp line or hashtag #NewNormal. On the show this morning, we'll look at a number of questions that have come up in the show in the last few weeks. This was one of the most frequently asked questions on social media. How much alcohol should one really take? And how much is 2 pints? We asked the police spokesperson a number of questions regarding the management of security during this COVID-19 pandemic. What should we eat? How can we have a balanced diet when we have nothing to eat? Well, we have an experienced nutritionist to give us answers.
Leo tutasoma Kiswahili.
Too many questions came up about the school, home and work balance. We'll try to get to the bottom of this. But first, we look at the state of COVID-19 around the world. And at this moment, we have 5,085,504 people who've tested positive for COVID-19 globally. Of these, 2,021,666 have recovered, while 329,731 people have died as a result of COVID-19. Coming to home in Kenya, this is the situation as we speak. We have so far tested 49,405 people. Of these, 1,029 have been confirmed positive. 50 Kenyans have sadly died, and we have 366 people who have recovered. That's Kenya. Moving across our region, starting with Tanzania, these are their numbers. In Tanzania, they have, if I can just get onto that in a moment. So Tanzania, our cases, 509 confirmed positive, 21 people have so far died, and 183 people have recovered. In Ethiopia, the confirmed cases stand at 365, 5 people have so far died, and there have been 120 people in Ethiopia who have recovered from COVID-19. In Somalia, the numbers are rising by the day. 1,502 positive cases, 59 people have so far died. Those recovered, 178. While in South Sudan, we have 290 confirmed cases, positive cases of COVID-19. 4 people have died, 4 people have recovered. In Uganda, we have 265 confirmed positive cases of COVID-19. No one so far reported dead, and there have been 65 people who have recovered. In Rwanda, 385 positive cases of COVID-19. No one, just like in Uganda, no one's been reported dead, and 209 people have recovered. While in Burundi, 42 people have been confirmed positive for COVID-19. 1 person has been reported dead so far, and 20 have recovered. That's the situation in East Africa and around the world as COVID-19 continues to impact the world in a big way. Now, households in Nairobi that are experiencing water shortage can only expect resumption of services in the next 2 weeks. Thousands of households have recently had their taps run dry, and this has been attributed to the heavy downpour and landslides which have blocked the water pipes. The crisis is exposing thousands of individuals to the lurking dangers of COVID-19. The Water Service Providers Association claims it has set up 600,000 clean water stations in Kibra, Nairobi, Kachonjo, Mombasa, and Nyagacho in Kericho for Kenyans to wash their hands.
Tunahitaji bilioni 1 na milioni 700. Na unakuta sehemu kubwa inaenda katika kulipa mishahara kama milioni 900. Kuna milioni 250 inaenda kulipia nguvu za umeme. Kemikali tunahitaji pia, kama tunaambiwa maji lazima yawe safi. Na katika ule usafi kuna dawa ambazo tunatumia kama chlorine, ile inafanya disinfection. Sasa utakuta dawa hii haiko katika taifa hili, tunatoa nchi za ng'ambo.
The fight against COVID-19 pandemic faces a serious setback with the ongoing water rationing in Nairobi. However, in Kibra, a solution is trickling in, with several residents being able to distribute the scarce commodity within their neighborhood. NTV's Seth Olale went to find the source of the solution.
Peter Ndamboki from Gatukira in Kibra slums has seen a lot of people come and go in the name of lending a helping hand in the 25 years he has lived here. Not a majority of the help has left them better off. But as a Juakali artisan and a father of 9, a solution has been brought that will help his trade and family through the form of free-flowing water.
Watu ni wengi, imeokoa majamii wengi sana. Kwa saa hii umesikia City Council wako na uhaba wa maji. Nimeshuhudia vijiji zaidi ya 6 hapa, wale wanatoka mbali wanakuja kuchota maji hapa. Laini inatoka hapa mpaka huko juu.
Food, water and shelter are among essential needs that the over 200,000 Kibra residents need. But provision of clean water during these hardship times occasioned by COVID-19 is a huge welcome for the population here.
Availability and distribution of free water in one of the country's biggest informal settlements could not have come at a better time when the nation is at war with the coronavirus pandemic.
Tena upande ya kufua tunachota tu maji na tunafua kwa nyumba huko. Hiyo imetusaidia sana. Tena upande ya toilet imetusaidia. Juu sasa kwa saa hizi hakuna pesa kabisa.
The filtration system that was set up in 2014 enables the available water that would have gone to waste to be repurposed mainly from hand washing points and showers.
The water goes through the filtration system that basically is an AA system. An AA system basically helps us reduce the fluoride content in our water before we give it out to the people. In addition to that, we do chlorinate our water so as to ensure that it's pathogen free.
Residents may not fully grasp the technology behind it, but they feel the change it has brought.
We are serving currently about 2,000 people a day for toilets and showers. And we're also serving close to about 1,200 people a day with our free water services. And they're mostly from the community around Gatekwera. I would say we directly impact about 80,000 residents of Gatekwera. Out of that 80,000, we're looking at 16,000 households. And within those 16,000 households, 6,000 are school-growing children. And about 1,000 small businesses like the ones you see around here.
The multi-sectoral project is powered by a solar system with the main electricity line as backup. This is being used as a prototype with the aim of replicating the process of recycling water elsewhere for thousands more to benefit, like Ndamboki and his family. Seth Olale, NTV.
Okay, so today our show is a little bit different. We're going back over the past few weeks to see some of the issues that you wanted us to revisit or to clarify using the experts that we have in our studio. And today we've got joining us via Zoom Dr. Susan Hinga, who is a psychiatrist. We also have here in the studio with me Mr. Charles Owino, who is the spokesman of the Kenya Police Service. We also have Dr. Gadenji Ndirango. He's a resident plastic and reconstructive surgery from the University of Nairobi and also Kenyatta National Hospital. His specialty is masks, those protective personal equipment. He'll speak about that. We'll also be joined by Sylvia Kuria, who is an organic farmer. We have Belinda Nyakiti, a nutritionist, also joining us shortly. We also have Modeu Kasanga, who is chair of the Kenya Private Schools Association. And all the way from Kisumu, Professor Julius Oyugi, who is a virologist at the Department of Medical Microbiology, University of Nairobi. His specialty is anything virus. We'll throw all those kind of questions to him. But to start with, someone who came on our show a few weeks ago, Sylvia Kuria. Good morning. Welcome to Your World.
Thank you very much.
Now, the last time you were on our program, you had some complaints. Could you remind us what your complaint was?
Yeah, as you've said, my name is Sylvia, an organic farmer from Limuru, and also farming in my Mahio. And 4 weeks ago, I was not very happy because I was not able to easily access my farm and the produce that we get from the farm to bring it back to Nairobi for sale. So what was happening was that by that time, there was no clear protocol of what we really needed in terms of paperwork at the county border on what I needed to show to prove that I'm a farmer to be able to access my farm and get back to my shop in Nairobi. And after we aired the show, things have changed, I'm happy to say. And what happened was I was able now to get in touch with our officials at the county level, and I managed to get a form from my chief. And the form is basically one that just states, gives the details of my name, what I do, and the travel that I have to make to go and get the vegetables and get it back to Nairobi. And since I got the form, what normally would happen now is that once I get to the border of the counties, the police would just look at the form and make sure, that, it's me and, the person is the one who's on the form. And then also I'm able to, they're now giving me a stamp to confirm that I'm out of the county and able to come back in again. So I've not had any problem whatsoever
okay, and
for the past 4 weeks.
And what's the conduct of the police that you meet on the way?
It's been very good, to be honest. I've been quite pleased. And I think since I was on the show last time, I think it really did help. It really did help because the police have been very good. They have been very kind. They have been very polite. And they just tell me, yeah, you're doing a good job. Thank you for feeding Kenyans. And I've had a pleasant experience, to be honest, for the past 4 weeks.
Okay, so last time, Mr. Owino, good morning and welcome to Your World. Yes. The last time we had this conversation, it was still very early on in the curfew time, so there were quite a few challenges. That was one of the issues that we brought to your attention in our very heated conversation at the time. Yes. But I'm glad to hear from Sylvia that things have changed. What has actually changed for you for her to experience that kind of reception when she's moving across counties?
Sometimes attitude and approach, because sometimes maybe somebody comes to a roadblock and he knows he's a farmer. She knows, for example, herself should know, I'm a farmer. And she's sure she's simply going to my Mahi or Limuru and come back. But the policeman does not have anything to prove that this is a farmer. Because, many a times everyone wants to cross over. People are attempting to cross over. You've seen people even trying to use panya routes, trying to use motorbikes and so on. So it puts police in a very awkward position. But when there's a clear way of identification, and we rely especially on the local chiefs, because they take responsibility. In event that he appends a signature on a wrong identification or information, for probably lie, we have at least somebody to account for that particular action. So once those protocols are done, then we have a clear way of clearing people to move. We also still have a lot of cases of deaths, people who have to be moved across the country. Somebody has died in Nyeri and has to go to Kisii. Somebody has died in Mombasa, has to go all the way maybe to Murang'a. Somebody has died in Nairobi, has to be taken to Nyeri. So those small protocols. There are also people who are sick, who are getting referred from various hospitals to hospitals in Nairobi. Paperwork is done appropriately. Okay. So I think what is most important is people to understand the implication of this situation in which we are, and people to try to be decent and people to try to cooperate so that they don't give us a hard time, and we also don't find ourselves in conflict, because that is not our responsibility. We have a very simple responsibility to enforce, and in the process of enforcing, we need that support from the general public. But the support will only come in if we understand the implication of the disease or what we are doing. So I think with that kind of cooperation from all the government agencies, services, institutions that can help us, I think we are going to do well.
Oh, okay, Mr. Winner, thank you. Yeah. So, Sylvia, before we let you go, anything you'd like to say to the police spokesperson?
Yeah, I just want to thank him very much because we're here with him at the show last time. And I think because of the way he spoke that, no one should actually, no farmer should actually be given a hard time at the roadblocks. I think that really did help. Maybe one thing to note, and also just to share with the other farmers, what I've noted even with the farmers that we are working with from the different counties, I found that, the paperwork is actually specific to the county level. So you find that our county, say in Kiambu, the paperwork we have is different from the ones in Kinangop and the ones from Moranga. And maybe what I would just advise is maybe just, as a spokesman has said very clearly, just work with the local authorities. They will be able to share with you what is needed for you to get across the county border, and there shouldn't be a problem beyond that. But I'm really grateful, because he spoke and he said, if you have food, you need to feed Kenyans, let people pass through. And I'm very happy, and all has been well, and I'm grateful. Thank you.
So even when you go back with empty trucks, when you've delivered food, you've not had an incident?
No, I've not had an incident, because what's happening is, remember now, as we pass through the, the borders, we are getting our paperwork stamped. So once you have an empty, like your vehicle is empty, as long as you have the stamp to say that you passed through well, then there is no issue whatsoever.
Okay. Sylvia, thank you very much indeed. Keep safe and all the best.
Thank you very much.
Okay. Now, Mr. Wino, just before you go into some of the questions that have come in, police, just like doctors and other sectors, are on the front line. What are some of the challenges from a police perspective of being on the front line of trying to stop the spread of COVID-19?
We kind of do almost everything, because you see, ours is enforcement, basically. For example, now we have the issue of the face masks, and we have clear instructions that we have to make sure that everyone has put on his face mask. And if you don't put it on, then we simply arrest you, and we are seeing the courts fining people on that. The challenge could be at one point, which now I'm not hearing, people would say they don't have access to face masks, but I think now almost everybody has access to face masks in one way or another. So that is no longer a very big challenge. But the major challenge would be persons who are trying to sneak out of these jurisdictions which have been restricted. For example, Isili is a very important hub in Nairobi. There are many traders who would want to go there. But basically what we are saying is that we are requesting people to understand the situation. There's no need of opening your shop and tomorrow you are dead. It's not going to help you in any way. So we have to, we always say that there's no gain without pain. This is the pain that we have to go through. And as officers on the front line, we also have challenges of opportunity of we handle quite a number of people, running from people who have died, maybe in their houses, that we have to maybe, but now currently we are getting support from the health institutions, because they come in well-dressed, whether the person has died normally or on COVID, at least they support us in ensuring that we are supported. Earlier before, it is just purely the police and the police to pick the bodies. Okay. But now you find the health authorities supporting us in picking the bodies, disinfecting, and transferring to hospitals. But also, you see, we have the report office. We have the cells. There are situations where there are offenses which you cannot release unless the court releases, and therefore we have to detain a few people, 1 or 2 or 3 in police custody.
Okay.
So we get a lot of interaction with people. When you go to roadblocks, you find the number of people that we are handling are so many, and therefore it would be a challenge. But the biggest challenge is cooperation, attitude of people towards police, because police are also human. And sometimes some people just provoke police unnecessarily. Some of these policemen are still very young.
But that should go both ways, though, even the attitude of the police to the public.
No, I agree. But you see, this is our country. And we are brothers and sisters. And we must respect one another in one way or another. And that is why in our case, we are very strict with officers who are disobeying standard best regulations. Okay. If we find you doing that, then it will be unfortunate for you. But I think most Kenyans are trying to behave. A large number of police officers are equally doing well. And I think if we cooperate, we are going to be able to manage this situation.
Okay, Mr. Wino, I'm seeing a comment come in. It's actually a question, I believe, yes, addressed to you. And this is from Aid Dahir, who says police are working in pathetic situations because they were not told what COVID-19 is, so they can easily contract the disease. So I propose they should be given risk allowance of coronavirus. So I suppose the issue that he's raising is how much awareness was given to the police? How much training did they have? Because you're used to handling a public order situation, but this is now a public health situation. How much training did the police get?
What's important, I think what people don't understand is that police work is an all-round work. We do a social work. I wish we didn't have these robbers with guns in town so that we can be able just to walk with batons, you know.
Like they do in some countries.
Yes, because like, for example, in the early 70s, we were not carrying guns. We were just carrying batons until when we started having a spate of robberies, armed robberies in town. And then now with these things of terrorism, it has put us to be heavily armed, like along the borders. We are almost getting armed like military along the borders, the equipment that we have to use. But I wish we would be in a situation, a social situation, where we don't carry firearms at all. Because this idea of us carrying firearms brings some stigma to people in the manner they think we are supposed to handle them. It can also socially make the policemen start thinking that they are there for purpose of force, which is not the case.
So for this purpose of COVID-19...
So what I would say is that
was there training?
Policemen are generally trained on disaster management. As much as it's pandemic, it's equally a disaster. And just like the same way you got the information the first day, I'm sure the first day you started seeing these was when TVs were showing people collapsing in China. Somebody collapsing on the street and they said there was a disease. That's how it came up. So the way you got it is the way we equally got it. Almost every policeman, I think, owns a TV, has access to newspapers and so on. It wasn't a very specific issue. But given that we are trained on disaster management, and also policemen, before you leave for work, there's what we call briefing and debriefing. Before you leave, officers are briefed on what they are going to do.
And when they come back from?
When they come back from, like those ones who go for patrol, you are briefed, and therefore you are made to understand the position. Okay. Lastly, the head of state and treasury has provided a small token in terms of an allowance for police officers.
For each police officer?
Yes, on this particular case. So they are taken care of.
Okay.
Yes.
How much, if I may ask?
I may not tell you.
Okay, I'll see if I can get out of you.
But at least it's reasonable for them.
Specifically because of the season we're in?
Yes, because it's temporary,
okay,
for about 3 months. And then I think maybe there would be consideration. And you know, we are facing very hard times because you can be sure that even government collection, what Treasury is now collecting,
is also gone down.
Has gone down.
Okay, Mr. Wino, pause for a moment. Let me say good morning to Dr. Susan Hinga, and welcome to Your World.
Good morning.
Yes, so you're a psychiatrist, and one of the issues that we've been asked by our viewers to talk about a lot is mental health. Now, can you give us a sense of what we are going through when we are stuck at home? People are anxious. What's your reading of our state of mental health generally in this season?
It is a very worrying season with a lot of concerns and a lot of apprehension, and that is for everybody. All people in the population are worried. We have lots of questions. It's a new thing to everybody, so there is generally a lot of increased stress levels and a lot of anxiety in the population in general.
Would you say that your own workload has gone up?
Well, currently patients are afraid of coming into hospitals. I'm sure you've had the talk of patients worried about coming into hospitals and getting checked for infections, and so some of them are keeping away, unfortunately. Although we're trying to get through to them and convince people that they need to come and take and be treated for various other conditions that are still with us in society. But what we are sure of is that in the future we expect that post-COVID and even during this time, we are likely to have more people with mental disorders, because when you increase anxiety in general anxiety, then there will likely be more mental disorders, and even patients who have been treated in the past may come back with mental disorders.
Now, let's talk about anxiety for a moment. A lot of people are anxious. They don't know what the future holds. They don't know whether their jobs will still exist or income will still come in. So what goes on in the mind in this kind of situation?
There is a lot of disruption. The disruption is to everybody, as I've said, in the population. I mean, we've had to think of different ways of doing things. People have to stay home and probably work from home. Children are not going to school. Some businesses have been disrupted, are probably not able to continue. So there's generally a lot of disruption, I've said, and a lot of worry. And I think what is even more worrying is that we don't seem to have an answer to say clearly, when does this come to an end? I know currently we are talking about our new normal, but our new normal is not what we are used to. So anything that comes and disrupts or changes our way of thinking or our way of doing things, including culturally, is definitely something that distresses all of us. But however, I want to mention that going through stress, which all of us are going through, doesn't mean that everybody will come down with a mental condition. People have different ways in which they take up stress and are able to deal with it. Some may end up with mental conditions with increased anxiety, but somehow a large part of the population will pull through and may not necessarily need to be treated for anxiety disorders or any other mental conditions.
And so from a professional point of view, at what point should someone start worrying that it's now going beyond just normal anxiety and they should maybe seek some help?
Okay, generally what we are advising the population is if you notice that your loved one or the people around you are having behaviors that are unusual, of course, that would make you realize that the stress levels or whatever they're going through is overwhelming to them. Disruptions in sleep and appetite, those are very usually the first symptoms when people are very distressed, so that some will have increased appetite and they will eat much more because eating is their way of calming themselves down. Others will not eat at all. Then if you have disruptions in your sleep, where you're either sleeping too much or you're not having enough sleep, times when people say they just feel generally overwhelmed and they are unable to cope with this. And of course, the extreme of which is when people start thinking they're not worth living and they start contemplating taking their lives, then any of those would warn us in the population that we need to probably take a step further and get ourselves or our loved ones to seek help.
And who would you say is most vulnerable in the season that we're in to mental illness or?
First, I'll start with vulnerability to COVID-19 itself, because we do know, we've been told, it's all over, that we know that people who are about 60 years of age and those who have pre-existing medical conditions are more susceptible to having complications of COVID-19. Now, when it comes to mental illness, we are looking at people in the past who have had a past psychiatric history of being treated for any medical conditions. We also know patients who are currently having pre-existing conditions who are aware, even from our media, that they are more susceptible to having effects, psychological effects of the post-COVID psychological effects. So we are also looking at those who have pre-existing conditions. We look at people in the past who may have probably attempted suicide or in the past have had to have some form of help, even if it's counseling or some psychological help, because they were overwhelmed by situations in the past. We're also focusing on children. Sometimes we forget children. We focus on adults, and children are asking questions. And sometimes we don't answer, and all they do is just see what's on TV, and we're not quite explaining to them what's happening to them. So these are what we would regard as vulnerable people in our population. And of course, those at the forefront. We have those who are law enforcers. We have medical people who are fighting at the forefront. So all these are vulnerable people who we are looking at, and we would get greatly concerned about their mental health status at this time and even post-COVID.
Okay, thank you, Dr. Inga. Stay on the line for us. Let me come to you, Mr. Wino. Speaking about mental health, the police are on the front line. Is this an issue for them? They see a lot, they handle a lot, as you were explaining. Is this an issue for them in terms of mental health?
It's not a very big issue because we handle more serious and worrying situations. The only disturbance is that, fine, for example, when we handle dead bodies on an accident, in your mind, the dead body will not kill you. But you see, when you are handling, except for when issues of blood, and therefore we had to use gloves and so on. But now when you are handling COVID-19 situation, what happens is that what you think of is the vulnerability in you, or the psychological torture in you, is that it's the mode of spread, because it is highly contagious. And therefore it means when you are handling that kind of a person, then you will find yourself in a situation where you are disturbed that you can easily catch it. But equally because of sensitization, in the sense that when you wash properly, you cover your mouth and nose and face, then you are in a better position. I think that resolves the situation. But I think we have faced more serious situations, and therefore it's not a very big issue compared to an ordinary person who has not gone through training. Yes. Okay,
I've got a couple of questions for you regarding the mask, if we can go back to that for a moment.
Yes.
Now, at the moment, it is mandatory for people to wear a mask in public.
Yes.
How are you? And we've seen almost, I think, 1,000 people who've gone to court, not just for masks, but for various other things across the country.
Yes.
What are the instructions to the police? When might you face arrest regarding a mask? When can someone fall foul of that particular, order or guideline?
I'm not getting you properly.
When can someone be arrested?
Yeah, either you've not put it on properly.
What is putting it on properly?
It must cover your mouth and nose. Some people would put it on like this. This is not appropriate. But you see, it's a matter of common sense, because you are supposed to, as a policeman, you are supposed to weigh the situation in which a person is. If he has the mask and he has not put it on properly, I think it is just best to advise the person to put it on properly or demonstrate. You may not need to arrest that kind of a person, because already he has a mask. But we also find situations where you don't have it at all. In such situations, they are arrested and they are charged. But it's just a preventive measure, because people, it's a matter of creating fear so that people can be able to always remember. The cost of treating people, or the implication when many people get this disease, definitely that we may not have capacity in terms of hospitalization to manage this. So the much we can prevent it, the better for all of us and the better for the state.
But now, how does a police officer judge that your mask is not on, put on correctly?
I think this is common sense. I've just said.
I'm asking this because we've had incidents of people. I know certainly one person who was arrested because they just lowered their mask to speak to in front of a police officer, and that was reason to be arrested. So we're putting a lot of response.
Why do you need to lower your mask to speak to a police officer? For example, if I was driving in my car and I'd put my mask aside because I'm alone in the car, when the police officer stops me, even myself, I usually put on my mask to talk to him, because the reason is preventive, because you are supposed to prevent the flying of maybe your saliva or maybe the viruses to the next person. Because, you know, even when I was coming here, I was so worried to talk to you without my mask on.
Yes.
But you told me it is safe.
It is safe. We're social distancing and we've sanitized where you...
it's safe. But practically, I think this is common sense. When you put it this way, you know it's not appropriate. When you put it this way, you know it's not appropriate. But what I'm saying...
you may say it's common sense, Mr. Wino, but, you know, some of these are expert, almost medical decisions that you're asking a policeman or a policewoman to make.
No, there are things which are observable. They are not technical. There's nothing technical in putting on a mask. The only thing is you are supposed to cover your mouth and nose, which is the major entry point into your body. So I think what I said is we simply require to cooperate, not to be complicated. And the policeman also requires to use his common sense that this person has a mask. And if he has not put it on properly, then just ask the person to put it on properly. Unless...
So it should not always be an arrest?
No, it should not always be an arrest.
Okay.
Unless the person does not have. And in many cases, actually, if we would be having extra masks, we would even give...
We have seen incidents of that as well.
Yeah, we would even give members of the public. You know, it's not to our interest to arrest people all the time. But also, you know, there are people who are born cheeky. You know, there are persons that naturally... they have certain inherent characteristics, bullies, you know, naturally in life. So you may have recruited a policeman or a policewoman who inherently is a bully. He would always want to bully people around. Even through your schooling, you know, there are bullies. Like you look humble. You don't look a bully. But you know, sometimes some humble people also have ways of bullying people. So you may find a policeman who is just born a bully, and he can easily... bully someone unnecessarily.
Should we be having those kind of police officers in the service?
No. We would deploy them differently. If you realize, if I'm a commander and I'm working with a young officer, I should be able to understand their characteristics.
Right.
And I should be able to mentor them. That is why some of us, when we were employed, we found very old, very old, people who looked old, policemen with maskio imekatwa mpaka chini. And they were very good old men. They would really take you through so many things.
So Mr. Wayne, it's just I got distracted because I noticed that Dr. Hinga there was getting amused when you're talking about bullies. Did you have a comment on this, Dr. Hinga?
Yeah, people have different temperaments or different personalities, as we call them. So there are those who are quicker to obey instructions and probably look at it the way it should be, that knowing that we are obeying these instructions for our own good. But there are definitely people in society who will test the limits, and there are those who find it a bit difficult to toe the line, just like what we are hearing from our law enforcer right there. And that is where law enforcement comes in, because the police are there, and the government is there to ensure that the law is followed. But so though some will find it easier to do it, and some may have a bit of difficulty, and that is where now force may have to be used. But generally, the population needs to understand, we all need to understand that all these restrictions are for our own good. They're not done by the government because the government has something against us. It's for our own good. And when we look at it that way, it's probably easier for us to obey and do what is right.
Okay, and just a quick one to you, Dr. Hinga. In terms of people on the front line, like police officers, they also are exposed to quite a lot. I don't know whether you at this stage, maybe it will be a post-traumatic incident after that. At this case, is this something that is of concern, or?
Yes, we definitely for people who are on the front line, like I've said, the law enforcers and health workers who are involved in dealing with patients or dealing with the public to try and help people keep order or obey restrictions, are more likely to be traumatized. But as I said before, not everybody who gets traumatized necessarily ends up with a mental disorder. People have different levels of resilience. People have different levels in which they have psychosocial support, maybe from family members or people around them, and they're able, eventually they do not end up with mental conditions. Of course, we also know that those who have genetic predisposition to mental illness, if they're at the forefront, then they may end up with mental conditions. And to add on to that, I don't just mean anxiety and depression and post-traumatic stress disorder as you're alleging. It could also be substance use. We have people right now who are sitting at home and all they do is probably just take alcohol in large amounts. So there are different things that people at the forefront may end up with issues that need to be dealt with post-COVID or even during this time of COVID-19.
Okay, Dr. Hinga, stay with us. Thank you for that. Now, as some countries around the world begin gradually easing lockdown restrictions imposed in a bid to stop the novel coronavirus from spreading, the WHO says the virus could become a constant presence, joining the mix of viruses that kill people around the world every year. According to the Ministry of Health, Kenyan researchers are working on a modeling based on the possibility of the virus being endemic, just like HIV.
Speaking at a briefing on Wednesday, WHO Emergencies Director Dr. Michael Ryan warned that it was impossible to predict when the pandemic will be fully controlled, and instead called the world to adjust to what might be the new reality.
I think it's important to put this on the table. This virus may become just another endemic virus in our communities, and this virus may never go away.
In Kenya, the Ministry of Health says it is preparing for such an eventuality.
According to our experts and scientists who are also doing modeling, that this picture remains true. Indeed, this virus may be with us for a long time to come, and therefore it requires us, one, to maintain our current containment measures, and to ensure that, two, we can actually chart a way forward as to how we are able to actually live with corona.
Countries will be forced to continue with the new normal or adjust to the reality of the longer stay of the virus among the populations, with more than half of humanity facing some form of lockdown since the coronavirus crisis began.
I'm sure you've seen different countries are putting in play interventions as to how they can continue with a new normal, because it will never be back to the olden days. This is a new normal, and therefore the same measures are being evaluated within the country. How do we maintain continuity of business while ensuring that we have social and physical distancing measures and that we are actually able to prevent the rising cases of coronavirus?
The virus first emerged in Wuhan in China late last year and has since infected more than 4.2 million people and killed nearly 300,000 worldwide.
HIV has not gone away, but we've come to terms with the virus, and we have found the therapies and we've found the prevention methods, and people don't feel as scared as they did before, and we're offering life to people with HIV, long, healthy lives to people with HIV. And I'm not comparing the two diseases, but I think it is important that we're realistic, and I don't think anyone can predict when.
The UN, meanwhile, warned that the pandemic was causing widespread mental distress, particularly in countries where there's a lack of investment in mental health care. WHO has urged governments to make mental health considerations a part of their overall response. Eunice Omolo, NTV.
Now, many Kenyans will have to continue to buy masks for themselves after the government said it cannot supply the protective equipment to every Kenyan, but will do its best for vulnerable groups. Victor Kiprop now tells us why the requirement to use the sometimes costly masks adds to the burden of many Kenyans who are already struggling to put food on the table in the face of the pandemic, and why some home-based solutions are even riskier.
To curb the spread of the virus, the government has ordered citizens to don the masks every time they are in public. But it would appear that many could struggle to comply, as the government says it cannot supply the equipment to all Kenyans.
But the government plan is actually to be able to distribute these masks free of charge through the county government, but targeting informal settlements. Because again, we are cognizant of socioeconomic realities in this country.
So far, 3 companies including Kitui County Textile Center, Bedi Investment Limited in Nakuru, and Shona EPZ Limited have gone into mass production of the equipment in the country, but the government says only vulnerable groups can access it.
They will be distributed, but not to each and every one of us. Let that be clear to everyone. They will not be distributed to each and every Kenyan. They will be distributed through the well-established structures, through the county government, to those that are vulnerable members of our society.
Meanwhile, the police who are responsible for enforcing the law are considering even more drastic measures to enforce the face mask directive.
Mwananchi out there, I'm still noticing, they are not on the mask. It is in these efforts that we want now to take another step to ensure everybody is on the face mask.
Okay, remember, if you've got any questions about masks or personal protective equipment, we've got the expert here to speak to us. If you've got a question for the Kenya Police Service, we've got Mr. Oino who can help us address that. If you've got an issue on mental health, we also have Dr. Hinga with us. And if you have issues to do with COVID-19 itself, the virus, how it behaves, the whys and the whens, we've also got Professor Oyugi who will be joining us shortly. But first, Dr. Ndirangu, welcome to your world. Good morning.
Good morning to you.
Okay, now the report there from Kipro was talking about masks, and some of them are not as protective as the others. So I want us to run through the masks, maybe starting with the different type of masks that we find available in the market and what they can do. But before you do that, help me something. We're calling you a resident plastic and reconstructive surgery from the University of Nairobi. What is that? What do you do?
Surgery. It's a branch of surgery I'm in training.
Okay.
Yes.
Sawa.
Yeah.
Please take us through the masks.
Before we go to the masks,
yeah.
I want to first talk about the levels of transmission of this virus. First, we have the contact, we have the droplets, and the airborne. So masks cannot work in isolation. You have to have all the three, and that is why for contact we're emphasizing on hand hygiene. For droplets now, transmission, that's where the masks come in. For airborne, now that's when we go to respirators. So for the masks that we have available, right now, mostly the cloth masks are the ones which are available. This one, the sample, another one. This is a surgical mask, and this is a respirator. It's R95. Now, the masks are graded according to the efficacy in terms of reducing transmission of various pathogens. We start with viruses, go to bacteria, we have pollen, and then dust. So in terms of efficacy, this one this is the most effective. Although this is R95, the N95 is actually 95% effective against most viruses.
Just to get that, what makes it effective?
It has a respirator. So it's a mechanism that controls the air that you inhale. So it reduces the amount of air that gets into your system from the external environment. So that's why 95% of the particles, in this case the microns of the virus, will be filtered before going into your system. Now, for the other bacteria, the dust and the pollen, still 100%. Okay.
So that's the most effective as far as these ones are concerned?
Yeah, as far as this one is concerned.
Okay.
Next, we have the surgical mask.
Which is quite common. Yeah.
Yes, but of course the supply now has also reduced after the COVID-19. This one now is also 95% effective against viruses, but the effectiveness against the other pathogens reduces. So for the bacteria and the pollen and the dust, the effectiveness markedly reduces. So that's the order of reducing efficacy. This is the best among these. The cloth now has come into the market because we are at the point of now local transmission.
Yes.
And we are trying to reduce as much as possible.
And affordability as well.
And, yeah, and still, the essence of the mask is to reduce the transmission of the infection, because if all the people are wearing masks, then you can effectively reduce the spread of transmission.
Has this got any filter? Some of them do, the one with the Kenyan flag.
This one is just a layer. Just a layer of air. Just a layer. This is the other filter.
Okay. How do you know when there's a filter and when there isn't?
It just will come with the specifications from the manufacturer.
Okay.
Yes.
So we see a lot of people wearing this one, the cloth mask with the Kenyan flag on it, or similar designs. How much protection does this give you?
Now, as I said,
as far as COVID-19 is concerned,
it will still offer some protection, because it will curtail the normal spread of the infection as it would have been if you're not wearing any kind of protective barrier on your nose and mouth. But because of affordability again and availability, now the surgical mask has also become a bit scarce. Most of the access is now to health workers, and this one even more. So for the protection that you can use, it will be effective, especially when in the local transmission, because now the virus is already in the communities, and we need to curb the spread of the virus.
Okay, tell me about the last one, which is,
this one.
Yeah.
This one is just a
cloth.
Cloth, but still has protection against bacteria, pollen, and dust.
Okay.
But minimal against viruses.
Okay.
Yes.
Now, maybe you want to help us demonstrate for us in terms of just how effective they are. We've got a spray there in front of you.
Maybe I can just demonstrate how to put on a mask well.
Okay.
So you first start, again, as I said, with hand hygiene. If your hands are soiled, you need to wash them with running water and soap. If they are not as soiled as mine, you can use an alcohol-based hand rub. And you have to do the proper hand washing. You first start with the palms. You rub the back of your hands, then between the fingers. Then this space, the thumb and the space between the index finger on the other hand also. Then you finish at the wrist.
Okay, so your hands are clean to handle the mask.
Your hands are clean. Now you take the mask. This is a surgical mask.
Which way around? Because there's also a debate about which is the outer side.
This one you can see. This is a layer here. So this is the inner side.
Okay.
This is the filter.
Okay.
Yes. So this is the outer side. So you should go this. Then adjust it on your nose so that it fits well. Make sure it doesn't touch the rest of your face as you're doing it. Then you take the top strap on the top of your head.
Yeah, above there.
Then the bottom, below the neck. Then make sure
so
it's well fitting here, and you can breathe well.
Okay. So you're properly masked up,
Yes.
as we say.
Yes.
Now, what I'm interested in is using that spray. I want to see what can get across to the other side, assuming there are some viruses there that somebody breathing. Are we able to test it on a mask to see whether it can actually pass through, or how much of it can be retained using the sanitizer?
With me on?
No, not with you wearing it. Sorry. No, just it's just a free test, not with you wearing it. Obviously, no. Yeah. Please help us with that.
Then now, after, with this or
the most common one, we can try with what you're wearing.
Then let me now demonstrate now how to take off a mask properly. Again, sanitize your hands. This is when using an alcohol-based rub. When using water, of course, it will be a bit longer.
Now, this is a single-use mask.
Yes, single use.
So you cannot recycle it?
Yeah, you cannot recycle it.
Okay.
So take the bottom part, just untie, then the top part, then you dispose it somewhere.
Okay.
And yeah. So
I want to see what we can do with that spray. I'm very curious.
About what?
In terms of what is able to, how much is able to pass through or to filter through that, or
oh, okay.
Yeah.
I don't know if we can demonstrate
with that. I know some people use
okay, maybe we can see.
Okay.
Yeah.
So literally nothing is coming through.
Yeah.
Okay. Let me do. Let's just one more time, because so it's only pouring down the mask, but nothing is actually passing through that mask.
Yeah.
So quite effective, that.
It's quite effective.
Okay. Now what about the?
Now this one has a layer.
Okay.
But you can still.
Let's see what happens with that.
Yeah. Still some protection.
Still some protection.
Yeah.
Okay. So nothing is. Let's do it one more time. Sorry. Yeah. See how far. Okay. That person behind that mask is safe from that. Let's go to
bit.
A little bit safe. No. Let's try the last one.
Still, yeah.
Yeah. So what does that mean? I'm assuming that's somebody's saliva, for example.
Still occurred some protection.
Yeah.
Yes.
Okay.
Some protection will still be there, but the efficacy matters in terms of the specific particles. If they are very, very small particles, the higher the mask is in this scale, the better it is.
But the nature of the virus itself, the new coronavirus, in terms of its particles, how would that play out with these masks?
Of course,
that one is the best, as you say.
Yeah, the order is as it is.
Okay. One of the questions that people have been asking is, when you go out to do physical activity, we're supposed to have masks all the time. Are there risks, are there dangers with wearing a mask while you're running or jogging, for example?
So when you're exercising, basically, if you're alone, there's no need to wear a mask. And actually, even if you're outside and you're keeping social distance, and it's a controlled environment, because now when you wear a mask for long, again, when you sweat and it becomes damp, moist, still becomes a medium for further infections. But now in that situation, if you have an extra mask, you can always change. You can always put on another mask.
Okay.
Yes.
Dr. Ndirango, thank you very much indeed for giving us this demonstration. Yes. Stay with us. We'll be right back. We're taking a short break, and your new normal, your world, will be right back.
The young ones are at home, and we know how that can go. Don't worry, we've got you.
A lesson will be learned.
-3 times -4.
They can have fun as they learn on NTV.
What does 0 mean? It's just a number that means nothing.
This is so much fun! It's our secret. NTV, turning on your world. Kids Edutainment in association with Blue Band Peanut Butter.
It's me Agatha. All right, I'll give you the money. But only to you, and not to Rocco. I don't trust that guy.
Where's Ginny? She's been staying with her mother's close friend. She'll be safe there. I need to finish whatever we started, Dad.
So where's the money?
I have it with me. I'm not giving Fabian the money, just to you.
As soon as I get the money, I want you to finish off Adele.
What about Fabian?
I'm going to do what has to be done. We don't have to split the money with the old man. We'll just take a step ahead of her. Agatha believes I'd keep my end of the deal. And I also know that she won't risk her mother's life just for the money.
What? What else? Of course they're going to take the bait.
I know how scary this all is, but it's something that has to be done. We can be strong together because we're sisters.
This is so thrilling.
Aren't you all done yet?
Yes, we're done. Sisters!
Nishaweka bando na mgoja umi mwalimu
anapambana yule dada
tanga nimwafulia kofia wametoa sanitizer za iliki yani ukipaka
You need to be ready for this week's show because just like last week's, we're taking it up a notch. Yes, Cardi B and Nicki Minaj are going to be going head to head to see who takes the crown on hashtag Tin Republic NTV. DJ Bash on the ones and twos, and you can send in your request prior so that he has you on lock soon as we start the show. Great conversations from all our guests, and of course you too can get involved, and all you need to do is send in your questions. If you have any comments, if you want to send a shout out, all you need to do is grab your phone, send us those videos via our DM. This is hashtag Tin Republic NTV. See you guys on Saturday from 11 a.m. to 1 p.m.
This is the time to make sure every table in Kenya has food on it. Dial *126# to transfer your bonga points now so they can buy food and necessities at any outlet with a Lipa na M-Pesa till.
Safaricom is for you.
Here at NMG, we are working very hard to ensure your favorite publications, Daily Nation, Business Daily, Taifa Leo, and the East African are readily available. In a bid to support the efforts to prevent the transmission of COVID-19, NMG has ensured our staff, our distributors, and their staff adhere to set guidelines. At our printing plant, all staff are required to wash their hands before entering the factory and must be wearing a mask. All workers either change their clothes on entering the factory or wear an overcoat. We are keeping doors open to avoid our staff touching door handles repeatedly. With our automated printing, contact with the newspaper is kept to a minimum, and at the packing process, the staff observes social distancing. Vehicles used to transport the newspapers are disinfected daily before the newspapers are loaded, and our delivery staff all wear masks and wash their hands regularly. Our vendors ensure that they sanitize every time they handle money and wear their masks at all times. NMG is proud to be able to safely meet your information needs. Stay safe, stay informed with our favorite NMG publications.
Now, scientists at the Kenya Medical Research Institute in Kilifi County are currently working on several potential vaccines together with other research institutions targeted towards fighting the spread of the coronavirus. They say that there is a total of 21 samples of the vaccine being generated by different institutions with hopes of finding one soon. Kevin Mutai also reports that over 8,500 samples of the coronavirus have been tested at the center despite several challenges, including finances and equipment.
The Center for Geographic Medicine Research in Kilifi County is a center for hope in the ongoing global efforts to finding a COVID-19 vaccine.
Samples that we have that are positive for SARS-CoV-2.
Over 60 scientists have been working in collaboration with other research institutions, both locally and internationally, to come up with the antidote. Some of the doctors reveal that at least 21 experimental vaccines are currently at different development stages, hoping to fast-track its production to be ready for human trials. Is there a possibility of maybe coming up with a vaccine to fight this pandemic?
We go in with a lot of hope that we'll be able to develop an intervention, and we want to believe that a vaccine will be found soon. The testing process itself takes long because you have to ensure that it works, but at the same time that it is safe to use in human beings.
Once you receive those approvals, it goes through a series of phases of trials. So you start in a small number and then you scale up to a larger number. In the small number, you're looking at safety. How safe is that vaccine in our population?
They also indicate that the virus has been mutating, but have been tracking the changes, which they describe it as similar to the strain of the virus found in Europe, China and other Western nations.
The virus is not changing very much. When we look at the differences between the sequences that we've picked up here in Kenya and those in Europe, there's still quite a large number of similarities between the viruses.
Kemri in Kilifi County has been among the main institutions testing coronavirus samples in the coast, but there is a concern over the inadequate reagents needed to meet the targeted mass testing as the pressure is on to increase the capacity.
But we have also had to mobilize reagents that we had already acquired for other research that we were doing.
Even with the search for a possible vaccine, doctors maintain that their focus is squarely on fighting the spread of COVID-19. Kevin Mutai, NTV in Kilifi County.
Okay, and now talking about vaccines and viruses, let me cross over to Kisumu to Professor Julius Oyugi, who is a virologist from the Department of Medical Microbiology at the University of Nairobi. Good morning, Professor. Welcome to Your World.
Good morning, Joseph.
Let me start you off with this discussion about vaccines. How far, in your view, how far are we, or is the world, how far are we from the first vaccine?
That's a very good question, Joseph. Remember, since the COVID-19, showed up in China late last year, by January, Chinese had actually, sequenced the genetic material of the virus, and with that information, many institutions across the world were able to start developing vaccines. And I want to let the viewers know that to date, there are over 200 vaccines that have been developed. Some of them are in what we are calling clinical trials. But the ones which have gone into clinical trials, I started seeing them from last month in April. Generally, it takes a minimum of about 12 months to 18 months to be able to, investigate the vaccine product and kind of approve it for use in human beings. And therefore, if we are looking at timelines on when we are likely to get a vaccine, I don't think that we may be able to get a vaccine this year, probably early next year, because of the processes required to test a product that will be used for a vaccine. As I have had, my colleagues from Kilifi, trying to explain, when I develop a product to be used as a vaccine, it must be tested in human beings, looking for safety and the ability of that product to induce the desired protection that will protect me from acquiring coronavirus and make me sick. So that is done with a lot of care, and the process goes on until the late stage of the clinical trials, where you are looking at issues like dosage. Should you give that vaccine once, or are you going to give it many times? What route of in administration are you going to give that vaccine? So all that kind of study goes on to the extent that also start looking at if it is showing signs of providing protection, then you also need to look at how long is this protection lasting in humans. So if you have a vaccine that is actually showing that it's providing protection, and the protection only lasts like 2 months, then you will have to actually be giving people that vaccine every 2 months.
Okay.
So because of all these factors, I think that the earliest that we may get a vaccine is probably March next year, not very soon.
Okay. Professor, thank you. Stay on the line for us from Kisumu. Now, I'm also joined by Mutheuka Sanga, who is the chair of the Kenya Private Schools Association. Good morning and welcome to Your World. You can hear me well? I will come back to you in a moment to just sort out your audio so that I can hear you as you speak. Now, Professor, let me ask you this as well. We have heard the comment there from WHO that the virus is, we have to get used to the virus. It's going to be with us, well, who knows for how long. What does that actually mean? That,
Joseph, that's a very good question from you. So WHO has said that this virus may be with us, and it may be with us for a very long time, just like HIV, came to human beings in early 80s, and it has been with us for over 30 years. It looks like COVID-19 virus is going to be with us for quite a while. And I want to explain to you why this thought is now becoming strongly believed amongst my peers and probably WHO as well. Number one, if we look at coronaviruses, I hope the viewers are aware that coronaviruses, there are many. But in human beings, there are 7 coronaviruses which have actually been circulating in human beings from 1960s. Out of these 7, one of them came in 2002 and disappeared in 2003. It has never been shown again, so we are remaining with 6. In 2012, another one showed up and it also disappeared, so we are remaining with 5. And out of these 5 coronaviruses, we know very well about COVID-19, which is one of them, but we may not actually know about the other 4. The other 4 coronaviruses have been circulating in human beings for over 40 years. And therefore, some of the coronaviruses, when they cross from animals to humans, they get adapted to humans, and they just stay like that for a long time. That's number one. Number two, the way this coronavirus is being transmitted, the virus is easily transmitted from one person to another. That is number two. Number three, those who get infected, remember, we have actually, it has been shown that you can actually transmit the virus even before you develop the signs. So there are a number of people walking on the streets in our communities who have been infected with COVID-19. They don't know that they're infected, but they're actually spreading the virus. So, which means the disease is spreading without even us knowing that we are spreading it. And finally, we also need to let the viewers know that with those who get infected with COVID-19, there's a large proportion of them who develop mild disease. Mild disease are people who are just showing with flu-like symptoms, running nose. Such persons may not know that they are infected with COVID-19, and they will actually also be spreading this virus within our communities unknowingly. Okay. So the fact that this virus is spreading efficiently, infecting a large number of people who do not know that they are infected, and some of them are infected and showing just mild signs, show that the virus is very good in actually adapting in human beings, and as such, the virus actually may be with us for a very long time.
Okay. Thank you, Professor. Stay with us. Mr. Owino, to you. When WHO says this virus could be with us for a long time, which means the public health crisis and the management of it will continue, what does that mean for the, for the police service, for example, if this is going to be with us for till, actually yesterday they were saying our peak could be anytime August, September. What does that mean for you?
Our role is simply, we are there to enforce regulations. So as time goes by, the health department will make several requests, depending on the mutations, depending on the nature of spread, and so on and so forth. The only thing that you have heard the professor saying that this disease is highly contagious and it is spread easily. But you see, like for example now, we are enforcing cessations for Isili and Old Town, Mombasa, and also for Nairobi, Kilifi, Mombasa, and the other and Kwale County. The problem would be is that if it spreads further, and we have to carry out more restrictions in movements, then it will have a toll on us in the sense that our numbers may not be very sufficient in doing this, or it would mean that we have to work extra hours, because maybe now we are working on shifts in the roadblocks. We may, if we are working 8 hours, we may start going 12 hours. We may reach a time where we have to go maybe 16 hours or 18 hours.
So you'll be quite stretched.
Yeah, so it depends on the nature of enforcement that would come in with time, because ours is to enforce. So if our services are required to enforce a particular restriction, we have no alternative, we have to do it.
So when some politicians want to bring back politics, which again calls for the police involvement in terms of maintaining law and order, that also puts you at a stretch.
We always don't mind about politicians. Politicians are always there.
But
they'll always.
But in the midst of a pandemic,
they'll always be there. The most important politician to us is the head of state, because he controls quite a lot. You know, that is why you hear government of so and so. As we see today, the government is for President Kenyatta, and with his technocrats, his executive and the technocrats would always advise. So as long as he's on our side, we would not be worried.
Okay.
Yes.
Is he on
we
your
can
side
only
now?
be worried if the head of state is not on our side.
Is he on your side?
Definitely.
Okay.
We are basically the tool of the executive
sure.
that he can use positively to manage law and order.
Okay.
Yes.
Thank you, Mr. Oni. Now let me come back to you, Modeo. Good morning. Can you hear me now?
I can hear you. I can hear you loud and clear.
Okay. Now you're in the private sector schools. From where you sit, when do you hope schools will resume?
This is a one question where I feel I can't make a call, because we are battling a health pandemic, and we really have to go with the experts on this. There is a lot of pressure in the sector to put the children first, which is the right thing to do, to put the children first. That said, we as a sector, we are under huge distress from the economic shutdown.
Having said that, as we've just been discussing, if we have to get used to the virus, if Kenya's peak will be later on in the year, in September, it means schools reopening will be further down the line.
Possibly, even though we are seeing slightly different things happening in different parts of the world, and I'm sure comparisons, because the whole world is battling this pandemic, at one point will be done to see what is the best practice, what other countries are doing with education. It will be important to us. The health advisories from other countries are showing that the younger children actually seem not to be affected by COVID. So there's a good number of countries that have either kept their primary schools open or are reopening their primary schools and lower secondary schools. So it's a question of seeing how the pandemic pans out in our country and drawing comparisons from other countries. And I'm sure the Ministry of Health and all the health experts are doing this and are going to advise us accordingly.
Okay, Amodeo, and just as you're speaking, there's a question that has come in specifically for you. It's from Ndukumulinge. Ndukumulinge is asking, why are private schools charging a lot of money, yet everyone is broke?
Yes, there's been quite a lot of discussion on alternative forms of learning during this closure. For the first time in the history of education worldwide, we have literally been brought into the 21st century. Education has been stuck in the 20th century for a very long time. And the pandemic has forced education systems the world over to literally just turn around and look at different ways of keeping the kids learning. For everybody in the world, it is clear that learning cannot stop. It simply cannot stop. And looking at other countries that have battled different pandemics, at the moment in Africa, the one place that we can look to for examples of how to do what we need to do during this time is West Africa. They battled between 2013 and 2015 the Ebola pandemic. And a lot of the script that we are seeing the Ministry of Health using is actually coming in from that end of the world. Learning has to be kept going. Long closures of schools, of education systems, and in war zones and in other places have shown that if children are not kept engaged, they actually experienced loss in the gains they had made that can be very significant. A lot of us in education had to deal with Sudanese kids who had missed out on education for long, long periods of time once the country stabilized. So it is, for us educationists, we actually have examples here in Kenya of how loss of education can happen. And this is something we don't want to happen to our children.
So the
issue of costs is pretty clear. It's a service being offered. Different institutions cost that service differently.
I was just going to ask you about that, because when kids are in school full-time, should that cost the same way as when they're at home online and the resources they are demanding of the school are fewer?
I need to agree with you there. The schools do need to work with their parent bodies to ensure that everybody is happy with what the schools are charging for this particular time. As a sector, we are pretty clear, and as associations, we've advised our members that we need to take away the costs that don't directly impact on learning while the students are away. So for instance, if a school is a boarding school, take away the boarding fees, all of it. Take away the meals and lunch, take away the transport. It's pretty straightforward and clear what a school should charge for tuition. That is pretty straightforward. And I must say I'm slightly disappointed in some schools that seem, I can't verify, but that seem to be slapping parents with fees that don't seem to take those factors into consideration. I have to admit, these are the very few schools. They are not the majority. It is not across the board that this is happening.
Okay.
Just as everybody is suffering out there from loss of income, schools need to also just keep that in mind as we send out communications to parents. I believe on the whole, a lot of these issues have been sorted, but we still do have a few cases in court. And these generally do not affect the 844 schools. So as far as our Kenyan curriculum is concerned, I believe we have fairness and everything is going on without any parent worry.
Okay.
At the moment, the parent worry is that a lot of parents are actually experiencing loss of income. And I urge schools to work with their parent bodies to ensure that where possible, schools can support parents who don't have incomes at this particular point in time.
Okay.
But I have to just point out that online learning is going on at its best in the international schools, and we are all watching. And now we can see where we need to get to as a country with our own system.
Okay, Dr. Muthe, I'll come on to that detail in a moment. Thank you for that. Dr. Hinga, over to you now. When WHO says that we are going to be living with this virus for quite a long time, this also talks about prolonged anxiety at home. What is that going to do to our mental health?
We definitely have to find ways to cope with the stress. As I said, COVID-19 is a negative stressor to all of us, to all people in the population. So we have to find ways of coping with stress. And some of these ways would be, one, to take a break from the news. When you keep listening to COVID-19 news, it can raise or increase a lot of anxiety in the population. People need to remember to take care of themselves, which would mean eat a balanced diet, find time to exercise, of course, while observing social distancing, and of course, avoiding substance use, and this, especially right now in our society, avoiding alcohol use disorders. Making time to unwind is something that we are advocating for. And finally, people should not forget to connect with one another. Just because COVID-19 is here and we are quarantined or in isolation or away from our loved ones doesn't mean that we can't find ways, positive ways to connect with each other.
Okay, thank you so much. Let me come to, I think we've got another guest joining us as well on the line. Yeah, Dr. Don, good morning and welcome to Your World. Let me try and establish contact with you so I can hear you clearly. Can you hear me on that end?
Yes, I can hear you very clearly.
Lovely. You're now loud and clear. I don't know how much of the discussion you're able to pick up, whether you've got a comment even before we move into your area of speciality.
Yes, I've been picking up everything. It's just been fascinating listening to Dr. Yugi and talking about the private schools. I mean, we're going through the same thing here on this end in terms of trying to figure out how COVID-19 is affecting all sectors and all facets of society. So yes, I have been abreast of the conversation.
And what lessons can we borrow from there, if any?
Lessons, we're still trying to figure it out. We don't have all the answers. I think what's happening is we are just potentially ahead in terms of the number and the scale of what's been happening. We've been in lockdown for almost 60 days now. We've just started to loosen it up this week. But we do know that we're nowhere near the end. We're not out of the woods by a long shot.
Okay, now we're talking about possibility of this virus being with us for a long time. What does that mean in terms of the services that you are introducing in terms of telemedicine and so on?
Okay, so telemedicine has been around for a long time, and telemedicine essentially just means accessing healthcare remotely. So if you think about it, since the 60s in Kenya, doctors, nurses have used walkie-talkies in rural areas. But however, now in the 21st century, now that we all have these mobile phones in our pockets, what we're finding is that access to healthcare has become a lot more convenient if you use your phone. So in this crisis, there's two main things that people have been told to do: to socially distance and also not to go into hospitals unnecessarily. So what telemedicine has done is it's been able to actually fit into this space by being able to provide healthcare for people who may or may not have COVID symptoms. And if they want to actually find out or speak to a healthcare professional, they can do that. The second thing is, if somebody does not have COVID symptoms and still wants to access healthcare, but has anxiety of going into a hospital, then we're there to be able to help them. So I think it fits into a very important space to be able to keep people being able to have access to doctors and healthcare.
Okay, just stay with us, Don. Thank you very much indeed. Professor Oyugi, let's come back to the virus for a moment. I wonder what you make of the way that the infections are spreading across the country. Does it follow a pattern that is familiar to you?
The way the virus is spreading across the country, the pattern is clearer. But what is concerning me, Joseph, is what I'm seeing happening in the big slums, in Nairobi, like Kibera, places like Eastleigh, where, the things that we talk about, like social distancing, use of masks, hand washing, cannot be, implemented for reasons that you and me are aware about. I'm worried that, if we don't do something about the spread of COVID-19, in slums, we may actually have very large number of Kenyans infected very soon because of the economic situation, the fact that these places are heavily populated, and the fact that, as I mentioned earlier, this virus is actually spreading silently, even amongst those who actually have been infected but do not show symptoms. So I think we need to act.
Sorry, your line getting stuck there, Professor. Mr. Wino, that's one for you. The challenges of trying to control or stop the spread of this virus in very crowded places and in slum areas. What has that meant for you from an operation point of view?
Sadly, I think I watched this yesterday. It must have been aired by one of the media houses, especially Kibra. It was very, very sad. And I think our National Security Committee must have picked it. And I think we are going to come up with a way of getting into this slum and enforcing social distancing. Especially, you could see they are opening clubs where they drink busa and changa. So I'm sure this morning, I came so early, so I've not had my meeting with my boss, but I'm sure we are going to move in and all slums ensure these clubs that they have are completely closed. So that we are able to...
Even though these people may not have other means of livelihood?
Yes, we have to close them. And government has a long arm. Government is big. Government would even include yourself. We may have to come with systems to help our brothers and sisters, even if it means deducting the little we earn and what you earn, because what is most important is life. We have to devise a system. Before we get in this vaccine, we really, really have to sacrifice. And I said, always, for you to gain, you must go through a lot of pain.
Okay.
So I think For what we saw in the slums, we have to move in with a lot of speed from this morning, ensure all those clubs are closed, and ensure that we closely supervise this area. And I think members of the public ought to realize that personal discipline is very important. Otherwise, we may be forced also to lock down Kibera, Madare, and those other areas. We may have to restrict movements, and we may have to sacrifice to get in there and be with them to ensure that if it means sitting there and controlling them, we just have to do it.
Hold that thought, Mr. Wino. Thank you very much indeed. Now we're on for a short break. We'll be right back with more on this discussion.
Basic protective measures as guided by the World Health Organization. Clean hands frequently with soap and clean water. Cover nose and mouth when coughing and sneezing with a tissue or flexed elbow. Avoid close contact 1 meter or 3 feet with anyone with cold or flu-like symptoms. If you have fever, cough and difficulty breathing, seek medical care early. Avoid raw or uncooked animal products. Help the world put an end to the spread of respiratory diseases by sharing this message with a friend. Message brought to you by Sour Herbal Family Bath Soap.
Working from home? No problem. Fiber Home has you covered with the fastest and most reliable internet speeds. Get connected today. Kazi lazima iendelee.
To achieve great things in life, you must do little things every day, like the 1, 2, 3 with Colgate.
1, wake up, wake up. 2, brush up, brush up. 3, smile through your day with a fresh breath and strong tea. Smile through your day with a fresh breath and strong tea.
Do the 1, 2, 3 with Colgate and give yourself a future to smile about.
He's considered one of the most lethal lyricists of his generation.
Milioni from 10 bob.
An eclectic performer with a number of positive messages, Giuliani joins us this Friday.
Nilibend knees, nika touch heaven.
Imagine, even though muingianga kwa klabu.
Having broken the internet with his smash hit Wajinga Nyinyi,
Wakini snipe tonight, simnajua ni kwa nini.
People have been asking for him, and finally he breaks his silence in this exclusive. I'm talking about King Kaka.
Goodbye, my friend.
My friend, fly, my friend. Goodbye, my friend.
An actor, director, singer, songwriter, the multi-talented Tokodi will get a hot seat on the trend. All this and more only on the trend right here on NTV.
COVID-19 is preventable. Protect yourself, your family, and the community. This message has been brought to you by the Government of Kenya and its partners.
Okay, our hashtag new normal has been quite busy. Let me have a look at a sample of your comments and what you've been saying to us. Said Dahir, who are frontline health workers? Is it only doctors who are mostly based in Nairobi? Why are they paid more than the rest? That is risk allowance. Okay, that may have come from a comment that was made earlier here. Francis Onkoba, you're saying, why is the government militarizing coronavirus? Shouldn't give incentives to people to step forward for voluntary testing. Okay, thank you, Francis. And then you have Favor Olunzi. Police officers should exercise reasonable restraint when dealing with civilians. That's a question that I know Mr. Wino is taking notes on. We appreciate the work police officers are doing now, but it should be done in such a way that it's dignified. Thank you, Olunzi. Mr. Wino is taking note of that. And to Charles Owino, unfortunately, police are crowding arrested fellows on the cruisers just because they didn't have a mask. Can the police be told to rationalize where the risk is high, avoid arresting people? Okay, so that question of putting everybody in one confined space. Thank you, Anto. And another one here from Mon Kinyu. People are avoiding hospitals because they fear being put on forced quarantine and they will foot their own bills. Thank you, Kinyu, for that. And this is Carl Rashid. Kindly ask Mr. Wino, how are petty cases handled in police stations, as the Chief Justice suggested during these COVID-19 times? So how are these cases being handled, the petty cases? Okay, he's taken note on that. We also have Angie Maina, you're saying being anxious is a normal reaction to COVID-19. Uncertainty, stress and fear are high. The threat of losing financial stability, health or loved ones stalks all of us. But all of these feelings are normal and not a sign of a pending mental or emotional breakdown. Thank you so much for that. And there is also someone on the line, on our telephone line, who has a question specifically for Mr. Owino. Francis, good morning.
Morning to you.
Hello, Francis.
Yeah, morning to you.
Good morning. You're calling us from Embakasi. Go ahead with your question.
Thank you, thank you. I'm very happy. I would like to speak to Owino. I'm very happy with the way, sometimes when he comes in interview, I'm very happy. He is a man who has no stress in his faith. So, in Embakasi, the insecurity is not okay. I am a victim who faced this problem during this pandemic because my car was stolen. Was stolen from where I live, and I was supplied with their rescue.
Francis,
yeah?
we can't hear you very clearly, and what you're asking is important. We're going to phone you back to when we can get you clearly on a clearer line.
Yes.
And then we will. I'll turn to Owino. We'll call you back.
I am clear now. Can you hear me now?
Okay. Yes. Go ahead now.
Oh, thank you. Kindly, Mr. Owino, I would like just a little advice from you because I'm very stressed. I'm one of them now entering depression because of the way my car disappeared. At the end, when I went to the police station, in fact, it was stolen on 7th April. Yesterday, that's the time when they opened my file for investigation. Yesterday. So it took too long without being assisted. Around the year, more than 10 cars have disappeared. And none of any has been placed.
Okay, so Francis, you're calling us from Embakasi, you're seeking assistance. Let's take your number. Mr. Owino is going to respond, but we would like to take your details to follow this up. But we'll ask Mr. Owino to respond to that and some of the other questions. Thank you so much for calling.
Yes, I'm very happy.
Okay, we will speak to you and take your details so that we can do a follow-up. Mr. Owino, there are a number of issues there. I don't know whether you can address them now.
Yeah, I would start with the question of militarizing coronavirus. What we are saying is that we don't have an intention to militarize coronavirus, meaning heavy presence of police officers. But when a situation occurs like what we saw last evening in Kibera, where people are carelessly drinking changa and buza and in clubs and even sharing the tins that they are using and they are not wearing masks, then it will force us to send a large number, a contingent of officers to ensure this is enforced. So we call for personal discipline and people to take care of one another. I've seen, especially in the villages, villagers are doing very well. If you're a stranger and you've gone straight away, they call the chief or they call the police and say somebody has come who is a stranger.
I think the issue of militarizing is even not just the numbers. Isn't it better to seek the cooperation of citizens? It is as much the problem as it is the police, rather than using
that's what I'm saying, personal discipline. For example, now we were not present inside the slum.
The slums, yeah.
But following what happened, we have to be present. We have to ensure that this is adhered to. Because at the end of the day, you will come back to us and say, why are you not enforcing Changa dens? Why are you not enforcing Busa dens in some of these places? You know, sometimes their Busa was somehow legalized in those clubs in the slum areas.
Right.
But you see now, they sneak in Changa. But you see, for the sake of now, all bars and these dens are closed, and therefore it has to be enforced.
Okay.
But when it comes to...
There was this issue of one of the questions you have there.
I'm moving on.
Yes.
There's reasonable restraint when enforcing.
Yes.
It's also a duty of a police officer to ensure that he understands the use of force when he's making arrest. And this is a basic training at recruit level. When you tend to, the instructors tend to concentrate so much in definition of what is reasonable force. Because if you approach me, you come to town here, you want to rob a bank, and you have an AK-47, you don't expect me just to come with my hand to hold you. You are going to kill me or kill the citizen. So the reasonable force will be an equivalent of that force or slightly higher power.
To continue.
But somebody who is drunk, who is staggering, why would you use a whip even to cane him? Why would you even want to slap him? That would amount to assault. Why would you want to mishandle that kind of a person?
I think part of the question as well was, when you arrest people and you crowd them
yes, I'm coming to that. There were a number of issues.
Yes.
So if you give me time, I'll handle all
Go
of
ahead.
them. Yeah, there's the crowding of people in Land Cruisers. I've seen it once in a while on TV. And the Deputy Inspector General in charge of police, Mr. Edward Bugwa, has sent out communication to officers that we must maintain distance.
Even
not
during
only
arrests.
when you are socializing, even arrest is a social role. It's part of socialization. We either bring in larger vehicles, canters and lorries, or we carry people in small numbers that is required. So they're under very clear instructions.
Okay.
And officers who don't follow this, you may not know, we undertake very stringent disciplinary actions, and they have to show cause. And this gets into your record, and nobody wants to spoil
if I'm facing arrest, can I insist on social distancing from the arresting officers?
You see, you know, always a policeman would tell you that you are under arrest. So if they ask you are under arrest and they ask you, please get into the van, and you walk into the van, nobody will touch you.
No, if it is very full, can I say, sorry?
Yes,
you're
you can.
risking my own
You
life
have a
now.
right, yes.
Okay.
You have a right.
Okay, let's move on.
What a policeman is a civil servant, and
Right.
he's supposed to serve you. It depends on the language. I don't know whether you saw the first days in Likoni when some well-built guy was mocking a policeman and say, you play around with me, I'll hit you, you know. So what we are saying is that it's a social responsibility for both of us, and,
Okay.
and they know that.
Moving on
and
to
then
the
there was a
others.
question of petty cases, how we are handling petty cases. We are trying to give cash bails as much as possible for petty offenders to ensure that they don't crowd in the police stations. So we are trying to enforce that. But during the day, especially morning hours, when we arrest people that can be taken to court, we take them before magistrates having jurisdiction.
Mr. Wino, we saw police in India who are meeting out their own kind of, they ask people to do push-ups or to do...
No, is
that available to you as well?
That is their jurisdiction.
Okay.
We are not allowed to do that here.
Right.
That is their jurisdiction. And if you can subject somebody to that, then definitely you'll undergo through a disciplinary process, which may not be very
Is this something you could consider for the Kenya Police Service? It would solve a lot of it. It would decongest our...
No. Yeah, the mode of punishment is only awarded by the court, not us.
Okay.
Yes.
All right.
Yeah.
I think there was one more.
The issue of The last issue was the issue of cars that are disappearing from Embakasi. Usually what we do when there is a particular crime surging up in an area, the Inspector General would definitely instruct the Director of CID. Through the Director of CID has a unit called Criminal Intelligence Unit, which should move in and get to understand the modus of operandi. Once we understand them, because usually you will find it is an individual or a group of people who are stealing these vehicles. And modus of operandi of criminals are always the same. They use particular styles. And I think if that gets into, because even the officer commanding station and the OCPD must have raised a red flag that yesterday I got this report of theft. The other day I also got it. Then he will seek assistance of his colleagues in Criminal Intelligence Unit to ensure that these people are nabbed. And that is why of late you can see we have very few or no bank robberies at all. We don't have car robberies because we are very lethal on persons who want to rob. And that one, even if you make a lot of noise, it's not, we have to
no
protect
compromise
you.
on
There's
that.
no compromise.
Mr. Wino, now thank you very much. Now, we noticed a lot of you have been learning new recipes during this stay at home. This period, baking, grilling, and many more delicacies are being served on your table. So we partnered with pishi.co.ke to bring you a weekly segment called #Pishi Home Chef. Now, how does it work? Well, a good question. All you have to do is cook a meal, any meal, or a meal that we'll be giving you as a challenge, record a video, or take photos, and don't forget the ingredients as well. Post it on any social media using the #Pishi Home Chef. And if we like what you've made, well, you become Pishi Home Chef of the Week. Now, here's this week's Pishi Home Chef.
We're making chicken biryani. So to start with, we're going to marinate the chicken, which we did last night. I like to marinate it for 24 hours so that the flavors can get in there. For the marinade, which looks like this, we have cloves in here. Then we have a bit of paprika, some cayenne pepper, some garam masala, salt, good old garlic. This ginger should have been in there, but I didn't have it yesterday, so I forgot about it. There's also cloves and of course fresh yogurt. So what we do first is we bake the chicken. I like to bake the chicken because it comes out nice and flavored. Afterwards, I'll show you what that looks like when it's ready from the oven. Now to make the sauce, we need onions. Because I forgot the ginger yesterday, I think I have to cook it for the sauce. Some grated tomatoes and some tomato puree. So I will cook that in here right now, and I'll guide you through the process later, a bit later, once we have that on the way. So this is the sauce with the tomato paste, the tomato, grated tomato, the ginger that I had grated. I like to add a bit of sugar because biryani is a bit sweet, so it tastes nice and sweet. Next, I'll add the marinade. So the marinade that was left from the marinade before I put the chicken in the oven, I'll just add the whole thing in here. Now, when you're cooking the tomato, just make sure that the oil comes up. That's when you know that it's cooked. So I'll just add that in there like that. Let's take a look at the chicken real quick. This is the way it looks. It doesn't have to dry up completely because it will go back into the sauce. So once it's done, I will just pour it into the sauce and let it cook for a bit. Yeah, it doesn't have to be super cooked or super dry. I'm just putting in the pieces of chicken into the sauce after they baked, so they can go in there and simmer for a bit. It's gonna be yummy. What I forgot to mention is that the marinade also has cumin. also has a bit of black pepper, but if you already have pepper, like hot chilies, you don't really need black pepper. Our biryani is ready, simmered. We just need to put it off and serve with some nice chapati.
Linda, for that. The chapatis stood out for me more than anything else. Thank you. Now, Belinda, you are with us. Good morning. You're a nutritionist. Can you hear me? Good morning. Welcome to your world.
Good morning. How are you?
Very well. We don't have too much time, but I want you to clarify a few things that our viewers have been asking. Let me start just before we go into the nutrition. Something about alcohol. What is a safe limit for men and women? 2 pints, 1 pint, and what are these pints anyway?
Thank you for having me in the studio. Well, the first thing that we need to clarify about alcohol is alcohol has no nutritional value. For example, if you look at how it is packaged, we can't actually tell from the label if you're getting any carbohydrates or we're getting proteins or we're getting any vitamins for it. So that is the basic line where we usually say it has no nutritive value. So when it comes to the serving, it's usually very simple. For the woman, we encourage you to have 2 drinks in a day, and for the man, we're looking at about 4. So in actual sense, the standard drink that is recommended is very simple. Say, for example, if you're doing your beer, we're looking at 355 ml. So that is just slightly above 1 glass, about 1 glass there. And then we have the distilled alcohol, the spirits, the liquors, we're looking at 45 ml. And then if you're looking at the mixed ones, we're looking at about 136 ml. Wine, we're looking at 90 ml. The whole idea is to have it in moderation.
Okay.
Because one, it does not have any nutritive value. And then if on the other side, most people say, if I'm allowed 2 or 1 drinks per day, can I pile them and have them at the end of the week? That doesn't make sense.
Okay.
If you look at
Belinda, let me pause you there for a moment. I know some of us struggle with the word moderation when it comes to alcohol, but let me pause you for a moment. Dawn, I want to bring you into this conversation. And telemedicine is going to become or is becoming our new normal, just like food.
Yeah. Telemedicine is one of those terms that's been used a lot with the new normal. And the reason is because I think we're going to be in this for a long time. We've got to understand that a few things are going to go back to what normal was in the past. So right now, we've got an amazing partnership with Telkom Kenya, where we're trying to be able to provide healthcare right across the country. And this partnership is great because this is Mental Health Awareness Week as well. And we know that the rate of mental health and illness is climbing, suicide rates, domestic violence. So it's able to touch in different facets in healthcare. And that's why we believe that this is going to be something that people hopefully will be able to adopt so that they can be able to actually get good access to healthcare right across the country.
What about people in the rural areas in Kenya who may be struggling with connectivity or other issues? How do they access telemedicine?
Well, we've got a toll-free line with Telkom, so they can literally pick up the phone or call 0800 22 10 11 and be able to speak to a care manager who'll be able to tell them what the process is. So that's the thing about telemedicine. We're able to speak to people in any part of the country. It's not just bricks and mortar infrastructure to get your healthcare. What we're trying to do is be able to democratize healthcare and have it to the greatest amount of people at the same time, which is also standardized in quality.
Okay, Don, thank you very much for that. Modeo, let me give you your last word briefly. How are you preparing? How is the private sector schools preparing for a return to physical schooling?
At the moment, we are focused on the health and safety measures. We are putting our focus there and trying to understand what the Ministry of Health expects from the private sector. The focus will be on health and safety measures. So we are advising schools to start investing in hand washing stations. We are advising schools to start looking at suppliers for masks. We are looking at trying to see how to work to protect the teachers and the adults in the schools, given that COVID is now clearly affecting the older people more than the younger people, even as we take care of the young children under our care.
Okay.
So my parting shot is here. Online learning is here to stay. I don't think parents should be afraid of it. It is what should have happened from 2013. And as a sector, we have totally failed, and we don't want this to happen to us. So there's quite a lot of future planning for online and the resources to ensure that we will not ever be caught out in this. Thank you very much. It's been a pleasure being here.
Thank you so much, Modeo. My thanks as well to all my guests, Dawn in the UK, as well as Mr. Charles Owino here with me from the Kenya Police Service. That's it for our show this morning. We'll be back, not Monday, I believe, but Tuesday. Monday is Eid, and in advance, may I wish all our Muslim brothers and sisters Eid Mubarak in advance. We'll be back on Tuesday with a hot workout at 6:30, and then our program, Your World, 7 a.m. Tuesday morning. See you then. Have a good weekend. Stay safe.
I help women find independence by training them in fish farming. It's tough on my back, joints, and can cause headaches. Panadol Extra relieves multiple types of pain. If symptoms persist, seek medical advice.
I'm a child of God. I am a child of God.
Oh, the overwhelming, never-ending, reckless love of God. Yeah. Burn it away, God. Burn it away, burn it away. I need. Burn it away, God, you are seated at the right hand of the Father. You are holy.
It's me, Agatha. All right, I'll give you the money. But only to you, and not to Rocco. I don't trust that guy.
Where's Ginny? She's been staying with her mother's close friend. She'll be safe there. I need to finish whatever we started, Dad.
So where's the money?
I have it with me. I'm not giving Fabian the money, just to you.
As soon as I get the money, I want you to finish off Adele.
What about Fabian?
I'm going to do what has to be done. We don't have to split the money with the old man. We'll just take a step ahead of her. Agatha believes I'd keep my end of the deal. And I also know that she won't risk her mother's life just for the money.
What? What else? Of course they're going to take the bait.
I know how scary this all is, but it's something that has to be done. We can be strong together because we're sisters.
This is so thrilling.
Aren't you all done yet?
Yes, we're done. Sisters!
Do your gums hurt? Yeah. Does your toothpaste contain sage, eucalyptus, myrrh, chamomile? All that in one toothpaste? Yes, try Colgate Herbal. Colgate Herbal contains nature's best herbs and Colgate's fluoride technology to give you strong teeth and healthy gums. Ah, Colgate Herbal. Let's go. Colgate Herbal for strong teeth and healthy gums naturally.